I'd like to thank everyone for joining us this afternoon for our second StationMD Service Information and Education webinar. We'll go ahead and get started with Toy Wilde, the project director for this project, and I will turn that over to her.
Hi, good afternoon, everybody. Can we hear me okay, Heike?
Yes.
Okay, so we're going to jump in, and I'm going to kind of go over high level just a little bit about StationMD implementation and just kind of talk about who's eligible and go through some of the things specifically around the service so there's a little bit more clarification. And then Megan will be joining us from StationMD to do kind of more of a presentation and kind of get into more of the logistics of what StationMD is and how you use it. So I hope you find this beneficial today, so we'll go ahead and get started. So just a little bit of overview about StationMD. So the division, our Division of Developmental Disabilities is excited to basically announce our partnership with StationMD. We obtained a contract with them and plan to use them for the next 6 months through this kind of COVID crisis period, but we're hoping that we can continue the service post. It is a telehealth medical service. It offers immediate virtual access to emergency medicine physicians. And these physicians are also specifically trained for our specific IDD population. So it is available 24 hours a day. It is a extra resource for our identified participants to be able to call in, or their family can call in, or their provider, if they're a provider working through an agency, can call in and really just get some extra treatment around any medically related concerns you have about yourself or an individual you support. Okay, so who is eligible? So this has been a question. We've got a lot of questions on this, so I just want to make sure we go over who is eligible. So all Medicaid waiver recipients are eligible to use the StationMD service. I wanted to clarify too, those that are on the wait list are not currently eligible, and it's not currently available to anybody outside of that Medicaid waiver recipient population. So that is really the scope of who is eligible for this service at this time. The division will be covering the cost of the service for the Medicaid waiver recipients. The only expense to the individual, family, or agency will be for the electronic devices, the communication devices such as a phone, tablet, or computer. Just so that you're aware, the main communication devices that you need to kind of access this service is the basics. Is it starts with a phone call, and we'll get a little bit more into that. A tablet or computer is what we consider kind of the next level up to where you can do that virtual service. So those are the things. So I just wanted to kind of give you just a little bit specifics on that. We have some questions around, is there a code that I need to be putting in Seymour, or any budgeting that needs to be done through the ISP plan, or things like that? And no, we are covering this, and you don't have to edit or do any changes to any type of budget. So as far as implementation of this service, implementation will be done in 3 increments over the next 4 weeks. So, and that's just generalities as far as the 4 weeks. We're hoping to be able to implement as quickly as possible, as we know that our COVID-19, peak date for Missouri is looming among us. So we're trying to get access to all of our Medicaid waiver recipients as soon as possible, and get everybody onboarded prior to that peak date. So those are kind of our goals and aspirations, and we'll continue to communicate implementation as we go through this. So I don't want you to feel as if changes won't be communicated, because we will keep you informed. So the first round of implementation, we are targeting 5,000 of our Medicaid waiver recipients. The same principle and kind of concept will be applied to subsequent rounds of implementation. So we're looking at our Medicaid waiver recipients as a whole. It's around 15,000 recipients. So we're kind of breaking that down into buckets of 5,000 for implementation. So that initial targeted round of implementation began this week. So we're very excited about that. So we're excited by the end of this week to kind of have our first round of implementation successful. So the other thing I just kind of wanted to make, and as a clarification for folks, is when we identify these 5,000, we'll kind of talk about a little bit more specifics of who falls in that and how that selection was made. What we are doing is kind of, in a sense, pre-registering, and then the individual or the agency gets to decide if they want to, and I say opt in, but basically choose if they want to use the service. That's a better way of putting it. So they get to choose if they want to use the service. So there's really no signing up or anything that you have to do. If you are identified in that area and that's when that's communicated that you're a part of this implementation round, then you can access the service at any time. You're ready to go. There isn't much to do, and we'll share, and Megan will go over more information on how you get that going. So implementation, some things that we're doing through this. So information letters have been sent to individual families in this first round and to staff and providers. We're also getting some wonderful assistance from IHD and sending communications to our in-home families. And then for our provider agencies, they will be sending out communication, though the division is assisting them and giving them resources and how to send that out. List of those on the first round of implementation are being sent out to the TCM agencies as well, so that service coordinators, executive directors, and such are informed. So there is multiple layers of communication around this. We are making sure that we layer the message and just encouraging everybody as you talk to folks that you really encourage your Medicaid waiver participants or recipients to utilize and access the service and make sure they understand it. So breakdown of our first round of implementation. On the in-home individual side, we have around 3,700. When we were looking, we were kind of looking at our hotspots in the state as regarding for COVID-19. So we targeted St. Louis, Kansas City, kind of central Missouri, and then the Springfield area. And then for the provider agencies, we had lots of great volunteers that we're very appreciative of. So Arc of the Ozarks, and you can see that list. I won't read it out loud, but that's what you can kind of see is in this first round. And then we are beginning our recruitment and getting things going for round 2. So we're very excited about that. Okay, so StationMD website and resources. So I just wanted to take a second. There is a website. It's listed here now. It's active and live where you can get more information. So there's a flyer listed on there. The flyer has more education about what is on StationMD, what's there, what it's about. And then you can also see the letters that came out from the division for individuals and families and providers. We've also listed the family packet, and the family packet is really that is something that you can send out to individuals and families to say, okay, this is how you access the service. This is a resource to send them to say, okay, this is what StationMD is. This is how you access it. And it has information on directions for downloading the app and how you use the StationMD app, what number you call, all of those good things. There is a telemedicine history form as well, and Megan will be speaking on it a little bit. On a separate line, even though in the family packet, the flyer and the directions for the app and how you download and use it are included in that family packet, we listed those as 2 separate resources for specifics. And then we have our slides, and we'll be adding the slides from this webinar today, including the recordings to these webinars so that you can use these as additional training and education tools. Okay, so I also wanted to just let everybody know we will do a Q&A session at the end. I would like Megan to be able to get through her presentation, and at the end I will help facilitate a question and answer session. So continue to type those in the chat, continue to think about those, and we will pull those up at the end of the webinar and be able to answer and address those. So I am very excited to announce and introduce you all to Megan. She is the Chief Operating Officer at StationMD. She's been working with us on implementing and getting this to our state, so we're very excited about it. So I'd like to welcome Megan and hand off to Megan.
Thanks, Tori. Good afternoon, everyone. Thanks for having me. I'm just going to grab my slides here, I think, on the side, and we'll get started. And as Toy said, we'll do some questions at the end for anybody that has any questions or anything that comes up. So just kind of keep track if you can. Sorry, give me 1 sec. I'm just trying to grab my. Oh, there we go. Okay, perfect. So first of all, we're StationMD, and we are a specific telemedicine company. We're a little bit different than most telemedicine companies, is that we kind of focus on caring for individuals with kind of vulnerable populations, individuals with intellectual and developmental disabilities, as well as those in skilled nursing facilities. Just trying to advance my slides here, sorry. I'm a little crazy here.
Megan, your slide control's on the left side of that screen. You'll see, if you'll hover over to your left side, you should see a bar there where you can arrow up or down.
Yeah, it's weird. It's not showing me the slide. It's just like a blank screen for some reason on my.
Are you ready for the slide about a healthcare solution to meet these challenges?
Yes.
Okay. So we have that there for folks to look at. Let me see if I can move this for you and see if it'll repopulate on your screen. If that helps at all.
Okay, great. I think they're just slowly, maybe it's just my connection is just slowly, have like, it goes from slide 10 to 16, but that's okay. I can kind of fill in the gaps, I think, in between. So just a little bit about StationMD. We were founded by a group of emergency medicine physicians, and the reason the company was founded was because as practicing emergency medicine physicians, they were seeing individuals coming into the emergency department for things that they thought could easily be taken care of in the home environment. And what was happening, they were coming in, and because many individuals with intellectual and developmental disabilities have a lot of other complex medical issues, they were getting a ton of additional testing that they may not necessarily have needed, and they weren't really getting a focus exam. A lot of times they were getting admitted more often than the general population just because they did have some complex histories. And the doctors felt, you know what, there has to be a better way to do this. And based out of that, kind of StationMD was founded. So a little background on the company. And some of our goals are really to, expand access to the most optimal care, decrease healthcare costs across the board. And then really, I think our most important goal is to improve the lives of people with IDD and their support team as well. We really like to think of ourselves as a resource, not only to families and individuals, but to others, support staff that help individuals as well. And we aren't necessarily just a telemedicine company. We do obviously treat individuals, but we have a lot of things in the background as well. So all of our providers are specially trained to care for individuals with IDD. We work very closely with individuals with additional providers around the country to develop some best practices. We work with Dr. Escude, who's very well known in the industry. He's developed a company called Hearst, which does a lot of screening for individuals with IDD, and then Dr. Kripke out in California does a lot of behavioral series in terms of working with individuals with IDD, and our physicians kind of get trained by both of those individuals and their tools so that they are, more able to, to better take care of individuals with IDD. We also have copyrighted treatment guidelines, so we do expect our physicians to use their clinical acumen, but we do want them to kind of go based on our clinical guidelines because those are developed on best practices on particular protocols for specific chief complaints that we've seen over the last 4 to 5 years. Because things in an individual with an IDD may be different than in the general population. Like, potentially someone that has cerebral palsy may have more issues in terms of their lung or airway, air capacity. Someone with, constipation and someone with IDD could be very different than it is in the general population. So there are some specific treatment guidelines that we do expect our providers to kind of follow, just to make sure that they're kind of hitting all of the basic points that need to be accounted for in the care of that individual. We do quality review checks on all of our providers. We look at every encounter where someone is actually transferred to an ER or an urgent care. But then we also do spot checks and look at a subset of all of their notes on every single month for each provider as well, just so that we can make sure that they're delivering the kind of quality care that we're expecting of them. And then we do really want to partner with our families and the individuals and even staff from different agencies. We just want to be a resource for them. So we do have ways in which we can help people if they just want to get a little bit of knowledge about wound care, or maybe their particular son or daughter may have a particular issue in terms of stoma care or something like that. We're always happy to help and have resources available on our website for that. So we want people to kind of think of us as an extension of any of the other services that they're getting. And we have had some great success in doing this. We've been doing it since about 2016. We've been pretty consistently able to reduce the number of ER transfers with all of our clients by about 85%, pretty much across the board. Which we've been we feel it's really great to see. It's really saved a lot of, people's time and obviously exposure and not having to go to the emergency department. And these are some of the diagnoses that you'll see that we have successfully treated in the home. In the blue, you'll see the ones that are the avoided visits, and then you do see ones that are in the gray where we certainly aren't able to treat everything in the home. One of the biggest ones being like sepsis. If someone gets so sick that they're septic, we can't treat them in the home. We would have to move them to the ER, which is why we really try to emphasize to everyone that uses the service that it's better, to call as soon as you feel that there's something not right, even if, the individual that you're working with or the individual themselves is not feeling well. It's best to call on that first day as opposed to waiting till the third or fourth day when that person may be too sick at that point and we have no choice but to transfer them to the ER. And just some bullets on when actually to give us a call. What are some of the reasons? And this is certainly not an inclusive list. I would start off by saying that really anything that you would not be calling 911 for would definitely be something that you can give us a call for. So these are just some of the examples. Rash, pink eye, falls. We are able to help in terms of oral health to some degree. Like if somebody has a tooth abscess or a cold sore, the docs can certainly take a look and maybe get them started on an antibiotic if needed. We certainly can't do any kind of dentistry in terms of pulling teeth or any of that through the telemedicine platform. But what we would try to do is to keep that person comfortable until they could get into a dentist or an oral surgeon to get the issue taken care of. And then there are things like vomiting and fever, cough, shortness of breath, which certainly in this time of COVID are warning signs, and certainly to give us a call if any of those happen. We can certainly also help with behavioral changes. We do not have 24/7 psychiatry. We have, but our providers are also trained in taking care of behavioral issues, especially behavioral issues in individuals with IDD, so they can do a lot of de-escalation techniques. So I would say certainly give us a call, and our providers will do their best to kind of work with that individual to kind of de-escalate the situation. And sometimes just having them being able to talk to a provider does kind of help them, refocus and kind of get calm the individual down and to kind of reset. And it does kind of help the people working with that person as well. I had mentioned constipation before. That's another big chief complaint that we see. But a lot of the things are not always necessarily emergent. There could be things like medication refills. If somebody has a question about a medication order, let's say they come back from the primary care physician or they do get discharged, they're concerned about whether they should restart up old medications or not. We're happy to help with questions like that. We will on a very case-by-case basis, refill like psychotropic medications or other controlled substances. I will say mostly in terms of controlled substances, they would be things for like a seizure disorder or some of those psychiatric medications. It would be a very, very, I can't really think of one off the bat, but a very rare instance where we would do, like a pain medication like an oxycodone or something where we would refill that prescription. But we would certainly, work with that individual or the support staff and do everything on a case-by-case basis from a controlled substance perspective. We're going to do our best to keep that person out of the ER or even in urgent care, especially in this time of COVID. So we're going to try to be as flexible as possible while working within the limits of our licensing as well. A couple of other, non-urgent things, and now I'm sure most of the day programs probably are not running, but prior to that, if people do need a return to a day program note, we could help with that as well. And really any kind of questions that people have, we're happy to help with. People, we often get questions about, especially in the time of COVID, like what are some of the symptoms? People want to, ask questions about that. We're happy to kind of field those questions, even sometimes dietary questions, or even, can I give somebody this if they've missed, can I double up on this if they've missed that in terms of medication? So we're always happy to help with that. And again, this is not an inclusive list. This is just to kind of get people thinking about some of the reasons that we would be, available in terms of our services to work with people. I did just want to kind of preface that some of the things are not always just a one and done type of thing. So if you're calling, for something quick and easy like a pink eye or maybe a rash, you'll talk to the doctor on the telephone. If there's a video capability, they will ask, to potentially look at the rash or look at the eye through the video platform. And then they would kind of make their assessment. Let's say they thought it was pink eye, they would do an e-prescribe some medication, and it would be a quick and easy thing. If someone does have something a little bit more complicated, especially like in this time of COVID, if let's say somebody has a fever, they may say, okay, listen, this is what they'll do their assessment with the individual. The individual appears stable, everything seems okay, but they'll probably, may say to that caretaker or to that individual, hey, listen, let's see how the next couple of hours go. Let's give some Tylenol. The person seems good now, but I want you to call me back in 2 hours or 4 hours, or I'm going to call you back in 2 hours or 4 hours. Let's just make sure that, the person is still doing well and progressing the way that we want them to progress. So there is some need to sometimes, have kind of a continual ongoing care for a person, and that could continue, based on what's happening with that individual. It could happen like for a day, or it could even sometimes happen over a course of 2 or 3 days where, the doctor would basically want someone to check in from our team, would want someone to check in on that individual, in certain increments just to make sure that they're continuing to progress. But that would certainly be communicated to the individual or any support staff so that they were, or any family members so that they were aware that that's what the doctor was wanting to do. Another thing that does come up is we are not here to replace the primary care physicians. I know now a lot of primary care physicians have limited their office hours or are not seeing patients at all. So we're certainly here to kind of augment that care and be available when they do not have those hours, and especially even in off hours or weekends. So we're not a substitute for the primary care physician, but we're here when they're not available, and we will certainly communicate our findings to the primary care physicians as well. If we have the information for the primary care physician, we'll do usually a secure fax to that primary care physician. And if it is a situation where the StationMD provider is particularly concerned about an individual and wanting to ensure that they get some follow-up, they may actually call the primary care physicians themselves to say, hey, I've seen John Smith. This might be the third or fourth time we've seen them for high blood pressure. I think they need to do a change in their medication. I've made some interim steps, but I think they need to have a kind of a long-term change and kind of have that discussion with the primary care physician.
And there, Megan, just to tee off that a little bit, there is a section. So on the website, the StationMD website it's on our DD webpage, the external-facing one. It's on our website, our external-facing website. But then there's a link on there that says click here to link to StationMD. Once you click on it and go in there, go to the StationMD website specifically made for DD in Missouri, and you scroll to the bottom, you will see a section to the left where you can fill out if you want that primary care physician communicated with and items sent to them from StationMD. There is a section where you can fill in that information there. So just know that that's how that process works.
Thanks, Joyce. And just also, just another, in terms of how the other documentation besides the documentation to the primary care physician would get back to either to the individual or family member or to support staff, there's a couple of different ways. I think, one of the easiest ways in terms of, an individual or family members would be a secure email, which we would designate, and that information would also be available through our website. If you wanted to go in and say that this is how you wanted to get a copy of the record, that information is also there as well to share with us so that we can set that up on our end. We can also do a secure fax as well. And then if any individuals are under the care of an agency, we can also add that information to an agency's electronic medical record if that is available. So a couple of different ways to get the information. And like I said, our line is always open, so if people are having a hard time getting access to the information, they can certainly give us a call back, and we can make sure that they get a copy of the note. And just kind of go through now. Sorry, go ahead.
Sorry, I was just going to say, and when we're referencing the number, so just so that I'm kind of trying to bring all the resources in context to where things live. So when she speaks of, giving them a call or calling your helpline, in the informational letter and also in that family packet, on the letter portion, it has the number. There's a number that you can call for StationMD for their helpline, and then there's also an email, a secure email as well. So I just wanted to point that out as we're thinking through and we're talking about these things. I wanted to identify kind of the resources that put those into context.
Thanks. So now I'm just going to kind of walk you through kind of the step-by-step process and how you would kind of interact with the doctor. And I know everyone has different potential technologies, and I think most people will hopefully have a smartphone to be able to do the video, but I do want to say that we can definitely still work with an individual if they do not have a smartphone, if they just are able to call through the telephone. There is a lot that the doctor can do just by speaking with them on the phone, so I don't want that to discourage people in any way. And really the first step of the process, regardless of what kind of equipment or technology you have, is really just making that phone call. That is the first part of the process, and it's always the first part of the process. And when somebody calls, whether that's an individual or a staff member or a family member, they're going to be asked for a couple of things. They're going to be asked for the state that you're calling from. They're going to be asking whether you're calling from home or from a provider agency. And then they're just going to ask for, your address, the name, and date of birth of the person that you're calling about, or yourself if you're calling for yourself. And then they're also going to just ask for the reason for the call, and they're going to ask again for the primary care physician. If it has not been loaded into our system, they will ask for that information. And if people do have the ability to get vital signs, whether that even just be, let's say somebody has a fever and you have a thermometer at home and you've taken the temperature and they have a fever, to relay that information. But if people don't have that information, they can certainly, not worry about that and just let the person that answers the phone know that they don't have access to or a way to do the vital signs. So after you give a call to the service, what they'll do is, if one of the doctors that's on shift is readily available, they'll patch you through. If not, one of the doctors will give you a call back within, we usually try to get back to people within a 15-minute time period. So you can kind of expect that would be the time frame. And then when you're speaking with the doctor, again, you'll kind of let the doctor know what your capabilities are. So if they do want to do a video visit, then they'll say, okay, do you have the ability to do the video? And then if you say yes, then you can kind of go on to the StationMD app and start the video visit. There are many things, as I said before, that they can take care of in terms of not having to do the video visit. And there may be things that they'll never have to do a video visit for. Like if you're calling for a prescription refill or a question about a medication, they won't really have to do a video visit for that most of the time anyway. So just in terms of downloading the app and having that available, I won't kind of go through this, but the app is called StationMD, and it's on the Apple Store and the Google Play Store. So that is available for you. And we do have links to these directions on the website that Tori was mentioning on our side as well. So if you click on that, it'll take you to these directions, and you could get the QR code, or you could just look it up and search it on either the App Store or the Google Play Store. And
as far as devices, she's speaking of, you can use a computer, a tablet, a phone, a smartphone. Any of those things are applicable for being able to use the app.
Yeah, and if you're having any technical difficulties and you do want to do the video visit and you're having technical difficulties, when you're speaking with the doctor will be the first one to know that. So either they'll help you through the process when you give a call, or they'll grab somebody on our team that's more technical that can help you out with that. So I don't want people to be concerned about that in any way. And especially I think another thing that I do want to kind of emphasize, if people are already kind of pre-registered and pre-enrolled in this program. So if it's 11 o'clock at night and they realize, oh, I actually kind of need to see a doctor, they don't need to be thinking about, oh, I have to go back and register or do something. It's fine. You can just give us a call. And if you even haven't downloaded the app at that point, we'll walk you through. It is a pretty quick and easy process, and we'll kind of get you through. The important thing is really just giving you access to the care. So whether we have to do that the first time on the telephone, if you are having issues or you don't have access to the video, we can do that. And like I said, if you haven't had a chance to download the app, we can certainly help you walk through it at that time as well. So I don't want people to be concerned about, oh, this is something I have to kind of do during, business hours the first time I use it, because inevitably people are going to get sick after hours and on the weekends, and that's when we're available. We're here 24 hours a day, 7 days a week. So these are just some screenshots on how you connect to the app. It's going to ask you for a one-time passcode, which is in all of the instructions as well. If you don't have the passcode, then the person that you're speaking with on our service will give you a passcode to enter as well, because we'll have everybody's information preloaded in our system already. So they'll know that you're authorized to use the system. And then what happens is you kind of get a little splash screen. The next screen kind of walks you through the steps again and makes sure, the first thing it does is to make sure that you've actually called the doctor first. Instead of just trying to do the video visit, we always want to have you call the doctor first. It'll ask you to put in your name then. The first time that you use the app, it will ask you to put in your name. That you won't have to do it after you do it the one time, but it will ask you the first time. And then you basically would just say that you're going to join the StationMD visit, and it then would connect you from a video perspective to the StationMD physician. And then this is just the Android. It's pretty much the same workflow. It's just on the Android, the screens look a little bit different. So depending on the device that you're using, whether you're using like a tablet or an iPad or an iPhone, the screens may look a little bit different, but they basically have the same functionality built into them. And I just was going to go through just kind of a quick sample case so people could kind of get a sense of what the flow looks like with a real case. This would be this is actually a real case where we had somebody with a 24-year-old with cerebral palsy and asthma. They developed a cough and a fever of 101, and their oxygen stat dropped to 90%. In the age of COVID, this is a little bit more scarier than it normally is on a day-to-day basis. But they realized that the person wasn't doing well. So in this case, it was a support staff member that called StationMD. So they called the 877-STAT-MD's number. They spoke with the provider while they're talking. Usually, when you're talking with the physician, if we have your medical records that have been sent to us ahead of time, either through the website that Toy had mentioned, or if you're calling from a provider agency and we have access of the records through the agency, they may be reviewing those records while they're kind of speaking on the phone about the individual, just to and then they'll kind of verify some of that information. And what they'll go through is they'll kind of just go through the whole process of go through kind of an exam, and I'll go through some treatment here, and they may ask someone on the other side to kind of assist in terms of doing the exam. If the individual's by themselves, they'll kind of just kind of tailor that as best as they can with that individual, knowing that they're kind of solo, which is usually fine. I did just want to say that if there's individuals that would want to join in on the visit. So let's say a family member or a nurse on call wanted to join in on that visit. So they could be in the video visit. They can do that as well. The doctor has the ability to send an invitation to those people, and then they can click and just be part of the visit. And you can kind of see here on the screen, I've kind of circled kind of what they look like. Our system is built on a Zoom platform, so it looks pretty much just like Zoom looks. It's just a HIPAA-compliant version of it. So here you have the big picture is the doctor here, and then you have like the individual, you have a family member, and then you could even have an RN. Sometimes we even have, depending on the situation, sometimes even the primary care physician may join because they may not necessarily have the ability to do video, but if our doctors can kind of facilitate and they feel the primary care physician needs to be involved, then we can kind of loop them in as well if needed. So here they're kind of just going through the motions of doing the exam. We do have some additional tools. We do have a stethoscope. I think that might be kind of a later phase if a later phase in this project if we decide to use that. But not everything needs a stethoscope, and the doctors are certainly fine in working without it if needed.
Hey, Megan,
and then after they do their
I'm sorry. Do you mind if I pop in with a quick question? It's really good and goes with this slide well. It's asking if an ISL is supporting several clients for the home device, will there be a way for them to indicate which client it is if the app only requires the patient's name to be entered the first use?
So if they're using the app, they can actually put in it doesn't honestly necessarily matter to us. It's just more so who the doctor knows that they're speaking with. So you can put in actually your name, or you could put in the individual's name. Let's say you're working let's say that you support a bunch of different people and you're working for a particular agency. You could put the agency name in. That name that goes through on the app is really just kind of an identifier for the provider to know who's that they're connecting to them, but they're also going to be speaking with you on the phone. So it's just kind of almost like a check and balance type of thing. And that name can actually be changed all the time. I mean, we do it so that once you do it, you don't have to do it again, just for the sake of simplicity and not having to repeat. But it can actually be changed. I don't know if I can make these bigger or not, but there is an actual. I think I can make this a little bigger, right? There's a button on the oh, but now I'm making it so you can't see it. There's a button that actually like a little pencil, and I'll kind of just put my cursor around it where you can click on that and you can change that name at any point. So you could, if you wanted to, if you were going from client, individual into individual, you could change it based on the individual, or you could put your name in, or if you work with an agency, you could put the agency name in. So a couple of different options there. Because in our record, okay, and because in our record in our system, it's still going to be based on the individual we're providing the care for. So who's ever coming in, however they're getting connected through on the app isn't necessarily as important as obviously what's in our record. That makes sense.
Thank you, Megan.
Okay. And then just to kind of wrap this up a little bit, so here in this instance, the provider was concerned that the person was having an asthma exacerbation and, maybe a respiratory infection, so they, prescribed doing some additional nebulizers. In this case, the person actually had the nebulizers in the home, but then they prescribed a steroid and an antibiotic. But also in this kind of situation where the person could have either done better or worse, the provider did want to do a follow-up exam and express that to the support staff that they wanted to do a follow-up in 2 hours. And so when they did the follow-up, the person's breath sounds did show improvement after the nebulizer treatment. The oxygen stat did go up, and in this case, the provider felt it was safe to continue to treat the individual in the home, and that's what happened. What was the outcome, and we were able to avoid an ER visit then. And then obviously the documentation would get put into either the appropriate electronic medical record or sent via email or fax, and the primary care physician is notified. We do, if the individual does have to go to the ER, we will ask the individual or the support staff what ER they're going to be going to. We do try to have it preloaded where we have like the closest ERs in our system just from where that person is, just for ease of not having to look up a ton of numbers from a doctor perspective, but you can certainly let the doctor know, what ER that you're going to be going to, what your choice is. And then the StationMD provider will call that ER, and they'll kind of talk ER doctor to ER doctor and say, hey, this is, Dr. Kaufman. I'm calling about Sally Smith. She was at home. We did an additional set of nebulizers. She didn't really seem to show much improvement. I had some concern. I want her to come in and get, a chest X-ray or X, Y, and Z, and then they'll try to express to the ER physician, if there is a way to discharge them home safely, that they can then check on them in the home environment as well. And they'll also give the history that they have on that individual to the ER physicians, that they have some background prior to the person arriving to the ER, which we hope expedites the ER visit then. And these are just the specific stethoscope instructions, but we can kind of go through these quickly. This is just kind of gives you an idea, kind of just gives you the ability for the doc to hear the heart and lung sounds. But again, I think we're going to do that in the second phase. And just some more information on training and how you can kind of get information on how to use the system. Normally what we do is we would send out some written instructions. Those will be on the website. For the individual provider agencies, we'll be sending it to those contacts as well, so their support staff have it. We do have training videos. We have open practice sessions every Monday from 1 to 3, Wednesdays 9 to 11, and Saturdays 10 a.m. to 12 p.m. We can kind of do remote training with about 24 hours notice, and we do have a training support number, a training email that people can call or email as well. If people call the training support number and we have someone readily available, then they'll just do the training on the fly. We actually have had a few individuals from their homes that have called already, and we've kind of gone through the process with them, which has been great. And then we have a tech support number, so if you're having difficulty with the app, you can certainly give tech support a call. But again, if you're having difficulty in terms of connecting with in the video piece, the provider will be the first one to know. So so the physician will actually either help walk you through that process, or they'll reach out to somebody that can. So I don't want people to be nervous about that at all. And that's really it. I guess I just want to emphasize that, we're here as a resource. I don't want people to hesitate to call. I don't want them to be, worried about, do I need to enroll or do this or that? Just, give us a call. We'll walk you through the whole process. Again, you don't need to necessarily have a smartphone. We'd rather have people call, and we'll do our best to kind of do the assessment through the telephone. It's really important now, as more than ever, to kind of keep people out of the ER and even those urgent care offices or centers, just to keep people healthy. So that I just want to emphasize that before we get into the questions.
Thank you, Megan. I appreciate your time on that and the thorough explanation. We do have, so we'll kind of switch over to the Q&A portion. So please type in your questions as they come in and as you're thinking of them. So we do have one question, Megan, that I'm going to direct your way. I know this isn't meant to replace the PCP. Would it be appropriate to use StationMD if specialists have canceled appointments due to COVID? Example, neurologist canceled appointment, but person is having increased seizure activity.
Yeah, I mean, definitely. I would, definitely call. We do get a lot of seizure calls, so those are something we are more than capable of handling and working with, and we can certainly help to try to either regulate medications or kind of get them on get them a little bit more stabilized until you can get back into the neurologist's office. And it could also be that maybe we, sometimes we have a little bit more luck reaching out to that neurologist if we need to kind of coordinate that a little bit. If you're not able to get in, if we're able to visualize and let the neurologist know what we're seeing and just try to coordinate that care a little bit more.
Okay, so as far as we have some questions basically around enrollment. So as far as individuals being eligible, they are Medicaid waiver, current Medicaid waiver recipients. So none of those that are in line. So yes, that's the current population that is for this contract purposes and this purposes of the service that is in that. let's see, will this be available even after the pandemic to be used? We're hoping so. The current contract is valid through August 31st, but we are working actively with IHD and other groups to kind of show the return on investment for this product, and we're hoping that it's something that we can deploy even after the pandemic as a resource. So yes, those are all options. They're just right now our focus, and the focus of this initial enrollment in service is for Medicaid waiver recipients, and it's through this kind of pandemic period, which is through kind of August 31st at this time. So the other question, it says, forgive me if I missed the answer or if this was provided, but how is this being rolled out to providers? How will we know that our individuals are in the system and approved to use the service? So we have identified, so what we're doing, and Gary, Wendy, I might have you help me with this. When you say provider, so there's kind of two different tracks. There's in-home families and provider agencies. For provider agencies, we are on the DD side pulling the list of Medicaid waiver recipients. So we have that kind of cumulative list. It doesn't mean that it might not be, in a sense, completely inclusive. We might, as we're pulling this, we might miss a couple people, so there will be a verification process. But we're basically identifying and sending, if it's a provider agency, we are sending them a list of, okay, who's eligible, let's get them enrolled. And then the provider agency is kind of sending out to their staff providers, who is in the program and communications around it with support from the division. If it's an in-home family, individual, what we are doing is sending out communications directly to those individuals and families, like I said, with the support of IHD through emails, phone calls, there's phone messages being left, snail mail, things like those that are being sent out. We're also coordinating with TCM agencies to reach out and providing them lists of who is eligible and going through this first round of implementation. So I hope that answers your question. If it doesn't and you have further questions on that, just continue to type those in. Will service be available? Okay. Okay, so we have another question, Megan, for you. Can I call StationMD from overseas as well, or are the services only restricted to within the states?
Meaning that the waiver recipient is overseas. I guess that was if the waiver recipient is overseas and needs services, certainly they can call. Yep. It's not necessarily geographic; it's tied to the individual.
Yes. Yeah. So the enrollment,
so
when they call, go ahead, Megan.
No, I was just going to say, so let's say that, let's say they normally potentially live on their own, but then they go to mom and dad's house and they're not feeling well. They don't have to be like at home. They could be at their mom and dad's house, whether that would be here or, Canada or whatever the case may be. Yeah, that would be fine.
And how they kind of verify too, just to kind of give some background, and Megan, correct me if I'm wrong, but is we kind of give them that enrollment list, and DD will be working with StationMD to kind of vet that enrollment list so that they have kind of a pre-populated list in a sense of, okay, who is active and that's kind of their verification. So when you call in and they kind of vet that list or look in their system, they have a current list of kind of who's eligible, if that makes sense.
Yeah, and they're going to verify that person by their address and by their name and their date of birth. And if the address has changed and it's like a previous address, they'll still go by the date of birth, because I know some of the addresses may have changed in between, or so we'll be able to verify that way as well. And if it's a provider agency calling, then they would give their agency name, because that would be kind of what the address was looking at. So if it was Center for Developmental Disabilities, and then the site was, I think there's a site called Nolan Manor. You would say you were calling from Nolan Manor, and then we would have the individuals from Nolan Manor that were enrolled, if that makes sense.
That makes sense. So we have a couple questions on, Do you have any examples of behavioral intervention that StationMD has fielded?
I mean, really, that it would be pretty much a kind of any kind of behavioral issue, and really the only time that we have to really send the individual out is if they're going to be a harm to themselves or others. Then we don't have a choice, but we do need to send them out at that point. But so if they're extremely violent, and we haven't been able to do any de-escalation with them, then and they're going to be hurting themselves or others, then we would have to send them out. But any other could be behavioral, and a lot of the things. I mean, number one, when you give us a call about a behavioral issue, the first thing that the doctor does is really to make sure that there's not an underlying reason for that behavioral issue. I mean, someone could have an upset stomach or could have a horrible toothache, and they're having a behavioral issue because that's the only way they can express it. So they'll, number one, make sure that there's not a medical underlying reason. And then if it is a purely, behavioral issue, they'll try to engage with that individual and talk with them and kind of do some de-escalation techniques. If we need more specific examples, I can certainly get some from the providers if you needed some more specific examples. But they are all emergency medicine physicians, so they are pretty well equipped in terms of being able to care for anything that gets kind of thrown their way, and they obviously see a lot of mental health, behavioral issues just working in the ED. So it's something that they're kind of used to in their regular job, and then working with us. They also just have additional training in terms of behavioral issues with individuals with IDD.
Excellent. So there's a refill question. If a refill is needed, will there be a limit on the number of pills written for will there be a limit on refills written for, basically?
No, that's something that they would normally kind of work with either the individual or who's ever calling, whether that be a family member, support staff to stay. I mean, the neurology one is actually a good example. And this happens not even just in the time of COVID, but let's say you have a terrible snowstorm and you're supposed to be going to the neurologist and you can't get there, and then you can't get another appointment for 6 weeks or something, and you're going to run out of the medication, but then they want you to come before they give you the medication. So there's a whole host of reasons why medication refills need to occur. So they'll normally work with either the individual or the staff or the family member to say, okay, when do you think you'll be getting them to, the next doctor's appointment? And then they'll kind of make sure they have a little bit of a cushion based on that.
Excellent. Thank you, Megan. Appreciate that. Let's see. Lots of great questions, so keep them coming in. We want to make sure we're answering them appropriately. There's a question, comprehensive waiver only or POH and community? It's all four. All four of the waivers are eligible. So I'm going to field a question over to Gary and Wendy. So we have a question about, one second here, I'm going to get to it. So Gary, Wendy, we have a question about what about individuals who have self-directed support? Are they eligible? So I'll give them a second to respond. I'm going to keep looking at questions as we're going through. I apologize if I missed this, but was the training just for how to use the system, or was it possible for training opportunities for staff, parents, etc. for medical conditions?
I guess I'm not, well, the training in terms of how to use with a specific medical condition. Yeah, I mean, that would be something that we if you give us a call at the number that's at the website, or even the training support number that's in the documentation, we can certainly help with that and put something together if you felt like you needed specific training on like I said, let's say wound care or something like that, then we can certainly send some materials and kind of go over that with family members. The training like that wouldn't necessarily happen like on the fly, but if somebody calls and says, I would like to have some specific training about this, then we'll get it together for them and then kind of set up a time to review it with them.
Hi, this is Gary. Sorry, we had our equipment malfunction here. So on the self-directed support, yes, if they're in the waiver, self-directed individuals are being enrolled as well.
Excellent, thank you. Okay, so another question. Our agency requires a neurological assessment for any consumer that falls and hits their head by an HCP. Will the physicians of StationMD be able to perform this type of assessment?
Yeah, I mean, that's a pretty big, one of our highest call volumes is for falls and to do an assessment after a fall. Yep.
So it says, so if the current doctor is providing telemed appointments already, we wouldn't need to change from their current process to this program, correct? So Megan, I can kind of speak to that and you can tag on to it. So this is a supplement. I think it's one thing to think about it in the sense that yes, you would continue to use your primary care physician. It's not a replacement. So no, you want to continue using your current care, your current PCP, and continuing those processes and continuing that program. But what this offers you is after hours, evenings, weekends. It gives you the option if your primary care physician is not available and you have emergent issues to be able to call. And Megan, feel free to add on to that.
Nope, that's correct. Yeah, it's really just to augment coverage when the PCP may not be available. Because we certainly, again, it's really important to try to keep people out of the ER and the urgent cares, especially now.
Okay, so I think we have vetted all of the questions and we're coming up close to the end of our time. I'm just going to run through really quickly and make sure that we have addressed all the questions coming in. I want to take a quick moment too just to kind of go over some of the things that were asked at our last session. So this is kind of an encore additional supplement webinar. So I wanted to just kind of talk about a couple things. So somebody asked if they'll have to submit their Medicare or their Medicaid or Medicare ID number. And that's no, we won't need that number.
That's true. The only thing that they would need either their DMH number or their Medicaid ID number if they wanted to add information into the website, so we would be able to properly identify them.
Perfect. And yes, and so a lot of people are asking about where this resource, will this be recorded? Will this be shared? It absolutely will. So it'll be on the website. And Heike, do you mind? I would just like to take a minute to just showcase really quickly the website and show everyone the website and kind of just click over to the StationMD part if we don't mind, or I can take over and do that too.
Let me get myself unmuted here, and I most definitely can, I believe. So give me just a second.
Perfect. And as she's doing that,
to that homepage.
And so just to let you know, too, from both of these webinars, we will be taking the questions and forming an FAQ that will also be available out there as well on the website. I just want you to think of the website as your one-stop shop for all your information regarding StationMD as well. We're really trying to make that an easy access spot for you.
Okay, so on that web page, if you go to our DD homepage, you'll notice just under that scrolling carousel that we have added a blue button that says StationMD. You click on that, and that will take you to the landing page for this. And you'll see there we have an introductory paragraph and some documents that have been posted. Below those documents that we've posted, there is a click here to go to StationMD button. Before I click there, please know that as we add additional documents and information, we will start to categorize this and make it a little more streamlined. So we recognize that that list is it's going to get a little unwieldy, but there is a plan to organize that effectively. And then when you click here to go to StationMD, I'm going to think about it for a minute. And this is what you are going to see whenever you get to their landing page. So general information, what is StationMD, how can StationMD help you, making that contact, gives you step-by-step information. Also, as previously referenced, where you might need that DMH ID number or your Medicaid ID number regarding getting information to your primary care physician. I'd also note on here that there are some documents to give you additional information for the providers, how to care for COVID-19 disability community, and other frequently asked questions. Also in that box you will see the contact information that was referenced earlier.
Okay, awesome. So we've came up to 3 o'clock on the dot. And I
did just see, Toy, a couple of questions about the passcode.
Okay.
So if you download the instructions, the passcode will be there. If for any reason the passcode's not working, that when you do call, they'll give you another passcode if needed to download the app. But once you have the passcode, then you're pretty much set and free to use the app. And then the other question was about having access to electronic health records. I think so. If the provider agency is able to give us access to it, that is great. And I think some of them have actually already worked with us to give us access to, I know definitely to SARAP for one of the agencies, and I don't know which one off the top of my head, but I can look and double check later. But we are, if they do have an electronic health record, they have been setting up access for us as well.
And then there's one question, does this count for people who are on waiver wait list as well? No, it does not at this time. Did you see the one, you might have addressed this, Megan, it's about the psych meds. If a patient is out of psych meds, we can call StationMD and get transcripts sent to pharmacy for refill.
You can. I will say that it does depend sometimes on the psych med. So some of the psych meds, I think clozapine, there is some specific things have to take place in terms of blood work and even an EKG in order to get those refills. So there's a couple of them that have some specific needs. But so it would be a case-by-case basis. But for the most part, yes, we are able to do that.
And then we're going to wrap up with one final question, because I don't want to keep you over too long, is if a person is between psychiatrist and StationMD, can StationMD be used to refill their medications until a new in-person provider can be accessed?
We can. I wouldn't want it to be like several months, so we would just want to try to minimize that as much as possible. And we can also certainly try to help in that to try to get you somebody, even if we do have psychiatry telemedicine providers on our staff as well. So potentially if they needed to supplement, we could try to work that. I mean, they do accept Medicaid and Medicare, so we could potentially work that through as a case-by-case basis, because I would rather have them under the care of a psychiatrist, even if it was an interim one, giving those medications, as opposed to having, months go by where we're just doing the refills and not having them be able to talk to someone and be assessed.
Okay, excellent. Thank you to everybody, especially thank you to Megan for the wonderful presentation and sharing your knowledge and information about the StationMD service. Thank you to Gary and Wendy for providing support and bringing this opportunity. And thank you, Heike, for coordinating. And for everybody else, we appreciate your time today. We hope that this service is a wonderful opportunity. If you have questions or concerns, please feel free to reach out. And we just appreciate your time. And again, any questions that were unanswered in the Q&A, we will make sure to get in that FAQ. So thanks for your time and have a wonderful day.
Thank you.